Well, welcome to our ongoing series of getting to know our new faculty. We're thrilled today to be with Dr. Adam Ubert in the Department of Cardiothoracic Surgery. Adam, welcome, and we're thrilled you're here at the Medical College of Wisconsin. Maybe we can start with why you went into medicine. Tell us where you grew up and how medicine came into your future. I know that you were going to be a professional soccer player, so medicine was plan B, but that's okay.
Yep, this was the second career choice for me. No, I appreciate you having me here. So I actually grew up in Milwaukee, was born and raised in the Heartland area, and medicine sort of happened through personal issues. My aunt, who was 4 years older than I was, we sort of grew up as brother and sister. She was diagnosed with acute lymphoblastic leukemia. And so growing up, I remember going to her doctor's appointments and just kind of seeing the care that the patients or the doctors and the nurses gave to the patients and to the families. It kind of sat with me. And then as she passed, the ability to kind of treat the family and the patient in and of itself, it sat with me. And so I had this desire. I thought I was going to be a pediatric oncologist. That was my goal for forever.
Yep.
And started taking anatomy classes and thought, nah, this is, surgery's kind of more in my route. I got to college.
So medicine, you were going to be a doctor from age
7.
Wow, isn't that great? Wow.
And I don't have any physicians in the family. And so it was one of those things that it resonated with me.
That personal experience.
Yeah. And I got to college and I was recruited to play soccer. And the first meeting with our academic advisors, they said, well, what do you want to do? And I said, pre-med. And they said, reconsider. And I said, well, why is that? And they said, well, with the academic difficulties and your athletic, requirements, it's just going to be too much. And I said, well, that's not a choice. And so kind of set them to prove them wrong. But
Oh, wow, good for you. So you played soccer at Marquette?
I did.
Oh, wow. How's the Marquette soccer team?
So they have gone through transitions. They've kind of gotten some stability back. And it's interesting to come back into town now and watch them play because their coach was the crosstown coach, so was our rival. So trying to get back involved with them is a little difficult just because he was the rival coach. But it's great. I mean, they've had some really good success over the past few years, and they're continuing to build and grow. And so I've been getting back involved with just...
Oh, that's neat. Oh, that's gred. So how'd you decide on surgery then? Since you were going to be, I presume, a medical oncologist probably, right?
Partially from the athletic events, and then in college you take anatomy classes and your different courses, and I just, surgery sort of sat with me. When I was a med student, I remember being on the medicine service, but they had a ruptured AAA, and I asked the chief resident if I could just scrub in and see it. And from that point, I was done. There was just nothing that was going to change your mind. Just watching the chief resident do the case without the staff really being in the room.
Well, and what was the motivation for cardiothoracic surgery? And then take us into your interest in critical care. How did that all evolve?
So when I was a resident, I struggled between trauma and cardiac surgery. I liked the critical care aspect. I loved the acuity of trauma. The difficulty was that I felt like trauma where I was at was becoming more non-operative, blunt force trauma and whatnot. And with cardiac surgery, you could do both the surgery and the critical care, which I really enjoyed. So that's sort of what started it. And then when I came back as staff at my hospital, literally the first day, we had a patient that arrested in the ICU, and I asked for an ECMO circuit, and they looked at me like I had no idea what I was talking about.
So now you're a fully trained cardiac surgeon.
Correct.
And you went back to where again?
I went back to Charleston, West Virginia, where I trained for general surgery.
Wow.
And they had no idea what I was talking about, and so then that prompted kind of the development of an ECMO service and an ECMO team, and kind of the need for more advanced critical care avenues because we didn't have that option.
Yeah, and for those who don't know, Adam is really an expert in mechanical circulatory support, a huge interest of the Division of Cardiothoracic Surgery. To venture a little bit away from medicine for a second, what was West Virginia like compared to Milwaukee, Wisconsin?
So it's, other than the weather, it's actually very similar. I think the people are very similar. That has their southern touch and just to the southern hospitality. The difference there is that people are just so unhealthy because they just don't have primary care. It's a mountain-based state, and and they don't have that primary care access, which actually I sort of resonate with kind of the northern part of this state, and you see
Sure, yeah.
patients that just don't get to see a doctor very often. But the people, I mean, they'll give you their shirt off their back. They're just incredible people. So.
Yeah, absolutely. Well, we don't really have the time to delve into your specialty, which is just so complex. The whole area of ECMO, mechanical circulatory support, leading up to even artificial hearts. Where do you think the field will be? Basically, the whole area of trying to keep the failing heart alive. Where will your field be in 5 to 10 years, do you think?
Yeah, I think, cardiac surgery is one of those things that has just incredible innovation that's coming through.
Yeah.
And, as we start, originally you had, the durable LVADs that were kind of a bridge to transplant. Now it's becoming destination therapy, and I think you're going to have more and more of that as the pumps get better, the total hearts get better. When you have a limited resource like a heart transplant, I think you're just going to have more and more patients that are going to have these smaller and smaller devices that are able to prolong life and have a normal life with it, essentially. So I think, as innovation continues to improve, you're going to have more patients with devices, and you're still going to have the need for transplant, but it's just going to be in a different patient population.
So we're going to be walking through Home Depot in a couple of years, and we'll be seeing someone with a little battery pack, and that battery pack will actually be driving a device to support the left ventricle then.
Correct.
Yeah, wow. Just incredible. And then they'll probably get charged through something like we charge our iPhone now on a pad.
Yeah.
So they may have a pad under their mattress or something, right? And they'll be charging their battery pack.
Yep, that's how they live now, and they walk around with their little battery pack, and most people have a pretty normal life and get along. So.
Wow. So what do you do outside of work?
I raise children. I have twins that are 4 years old.
Yeah.
And I have a 10-month-old. And so my wife is incredible. I mean, I don't know how she even puts up with all of that, but, it's one of those things that when you leave here, you've got something else going on, whether it's karate, soccer, dance, just some sort of child event. And I've started coaching soccer a little bit with my little ones, and so we'll see how that progresses.
So the 4-year-olds, boy, girl?
One each.
Oh, wow. So and they're actually engaged in soccer. They're not talking about, Frozen 2 or something in the middle of the.
Toy Story is absolutely their best friend. All they want to do is go to Disney and find Buzz, but they've actually started to, with soccer, the U.S. men's national team has had the World Cup qualifying, and I had the game on the other night, and all of a sudden my son got super excited, which is the first time he's actually done that.
Yeah.
It just sort of brought some joy, because he never really had any interest. It was always, can we watch Bluey or,
there you go.
Whatever.
There you go. Yeah. Well, Adam, we're so thrilled to be here. Thanks so much for spending some time with us, Dr. Adam Ubert.
Thanks,
Adam.
Appreciate it.